Welcome to PSMP Pro Notes, where we simplify community medicine for easy learning. Whether you're just starting or need a quick refresher, we've got you covered with clear and engaging content. Let's get started. Hit subscribe and the bell icon for more content, and check the description for
Measurement
notes.
of mortality. You'll see this topic not just in your exams, but also in your future clinical and public health practice. So let's unpack it together, clearly and practically. Why is mortality data important? Let's start with a simple question. Why do we measure death? Well, think about this. Every time a person dies, it's not just a personal tragedy. It also tells us something about the health of a population. Mortality data helps us understand what people are dying from, who is most at risk, and how that changes over time. It's the foundation of epidemiological studies and health planning. Governments around the world collect mortality statistics every year. And yes, it's one of the easiest types of data to collect accurately, especially compared to disease incidents, which often goes unreported. What is a death certificate and why does it matter? Now let's talk about a key tool in mortality data collection, the death certificate. Think of it as an official document that doesn't just say someone has passed away, but explains why and how. According to the WHO, it's divided into two parts. Part 1 lists the immediate cause and the underlying cause of death. The underlying cause is the main disease or condition that started the chain of events leading to death. For example, if a patient dies of septic shock due to pneumonia caused by COVID-19, the underlying cause is COVID-19. Part 2. This includes other significant conditions that didn't directly cause death, but contributed. Maybe the person had diabetes or chronic kidney disease. In India, the death certificate includes details like name, sex, Aadhaar number, place of residence and death, and whether the death was medically attended. Sounds basic, but it's gold for public health surveillance. Now let's be honest, no data is perfect. Mortality data has its share of limitations. For instance, incomplete reporting, especially in rural or under-resourced settings. Inaccurate recording. Sometimes, death causes are guessed or not properly recorded. Lack of uniformity. Different states or countries may code deaths differently. Single cause reporting, which means we may miss out on comorbid conditions. Changes over time in disease classification systems. And lastly, mortality data doesn't tell us much about low-fatality diseases like mental illness or arthritis. These might not kill, but they do cause immense disability and burden. How is mortality data actually used? Let's talk applications. Mortality data helps us track health trends over time, understand disparities, like why one region or gender has higher death rates, prioritize health resources, like deciding whether to invest more in cardiac care or maternal health, monitor intervention programs and evaluate impact, and even give us clues for future research. So yes, it's not just about death. It's about life, health, and better decisions. Let's bring in the numbers now. Mortality data becomes more useful when we convert it into measurable rates and ratios. Let's go over a few key ones. 1. Crude death rate, CDR. This is the most basic mortality measure, PIN. It tells us how many people died per 1,000 population in a year. Simple, but it doesn't account for age. That's a problem, because older populations naturally have more deaths. So remember, crude death rate is useful for a snapshot, but not ideal for comparisons between places with different age distributions. Now we go deeper. Specific death rates look at cause, age, sex, or time period. For example, if you want to know, what is the TB death rate among males aged 15 to 24 in Telangana during 2023?
This is the tool you'll use. It's very useful for identifying at-risk groups, making public health decisions, and doing etiological studies. Now, this one is interesting. It tells us how deadly a disease is. CFR equals number of deaths due to the disease / number of cases. For example, if 10 out of 100 cholera patients die, CFR is 10%. It gives us an idea of virulence or killing power. Very useful for infectious disease outbreaks, but not so much for chronic diseases like cancer or diabetes. Proportional mortality rate, MRS. This one tells us the proportion of total deaths due to a specific cause. For example, if 20 out of 100 total deaths were due to cancer, PMR equals 20%. It helps in priority setting, but does not indicate individual risk. Survival rate. And finally, the survival rate, the proportion of people who survive after a diagnosis or treatment for a specified period, like 5-year cancer survival. It's one of the best indicators of treatment effectiveness. Standardization, making fair comparisons. Let's say you want to compare death rates between Kerala and Bihar. But wait, Kerala has an older population, so naturally, their crude death rate may be higher. To make this comparison fair, we need to standardize the rates. Direct standardization. In this method, we apply the age-specific death rates of the study population to a standard population. It requires reliable age-specific data and is best used when comparing large populations. Indirect standardization, SMR. Sometimes, we don't have all the age-specific data we need. In such cases, we use the standardized mortality ratio, SMR. Point SMR equals observed deaths over expected deaths times 100. SMR equals 100, same as expected. SMR always over 100, excess mortality. SMR less than 100, lower than expected. This is especially useful in occupational health studies or small groups. Other tools and techniques. We also use life tables to summarize survival across age groups, regression models for adjusting multiple confounders, multivariate analysis in complex datasets like cancer registries. Summary table of mortality measures. Here's a quick recap. Measure, what it tells you. Crude death rate, overall mortality. Specific death rate, cause-specific risk. Case fatality rate, disease severity. PMR, proportional burden of disease. Survival rate, prognosis, treatment effect. SMR, standardized mortality comparison. Conclusion, let's wrap it up. So that's your comprehensive guide to measurement of mortality. We've looked at what mortality data is, how it's collected, what it tells us, and how we analyze it using rates and ratios. As a future doctor, these tools will help you think not just about the patient in front of you, but about populations and patterns. Because medicine is as much about people